An estimated 15 million Americans work in some kind of rotating shift, a shift that might include overnights, evenings, and early mornings. Most will admit that it leaves them tired. In related news, orange juice comes from oranges, but a new study says now it could also be bad for your heart and especially bad for women, which now, again, makes it especially bad. What exactly, Doctor, did this study find?
Right. So this study looked at data from more than 300,000 nurses. It's been an ongoing study since 1976. So, we really have a good, just a good amount of information. What they found was that nurses that worked night shifts for longer than 10 years had a 15% increased risk of having heart disease, including heart attacks, including having clogged arteries that needed to have a procedure. And that's a really significantly increased number. But what was particularly interesting about this is that they controlled for other factors. Like we know some risk factors for heart disease: smoking, being overweight, being sedentary, having a poor diet. Once they even adjusted for all of those things, just working the night shift in and of itself was still a risk factor for heart attacks.
Essentially, the stress on the circadian rhythm of humankind now increases the risk?
Well, that's sort of the main theory. They think it has a biologic effect on our brain. Our brain and our body still are one. Your brain has a circadian cycle. It controls so many aspects of what happens in our body, our hormones, our metabolism. And if your brain is not in sync with those rhythms, it can have long-standing effects on your body as well. It increases inflammation within the bloodstream. But then there are other things. If you work a night shift, you may have less social support, right? I mean, you're not around your friends and family during a normal time. A number of other sort of environmental factors can happen in the home that then also increase your risk of heart disease.
So if I'm a smoker, I can stop smoking. If I have a bad diet, I can theoretically change it. Perhaps if I'm overweight, that change in diet perhaps can fix that. I can walk more. I mean, I can attack a lot of the factors you just mentioned, a lot of the things that they selected for. What, if anything, can I do to decrease the risk otherwise?
Sure. So I mean, and that's the million-dollar question. And of course, I feel slightly hypocritical here as a doctor. I know I've pulled a whole lot of night shifts, and working in news and as a reporter, sleep isn't necessarily prioritized. The researchers did point out that if you could limit the number of night shifts you do, instead of doing 10 years, if you could do 1 or 2 and then readjust to a normal daytime schedule, that's important. Or if you are on a night shift, it might be a good idea to shift your entire life. Rather than do your night shift and then sort of try and power through the next day, try to go to bed at the same time, wake up at the same time, even if it's at night, so that your circadian cycles can start to adjust. You don't have that shock.
I mean, anecdotally, obviously, I can speak to the wisdom of the theory and the near impossibility of the practice.
And I'm right there with you. But still having this information, it might even change the way employers approach night shifts, right? Maybe we can do it in smaller periods of time rather than just assigning someone a night shift for 10 years, which we know will have these effects. Maybe we can rotate the night shifts, do it for 1 year, and then change staff out that way. Certainly, medical training, we're behind the ball. There are just night shifts every other night in the worst way possible, and that's kind of the way it is. But the more information we have, the better argument we can make that these things should change.
I'd ask you for a note, but right now, hey, my employers are watching this, so we're going to clip this. We're going to clip this and we're going to save it. It'll be there for you folks in corner offices and such, all right? You heard it from the doctor. Dr. Holly Phillips, as always, we appreciate it.
Great to be here, Josh.